نبدأ ولا شوية في حديث جانبية؟ كله تمام؟ So today we'll talk about inshallah last lecture in the, for me at least, the cardiovascular block. So we'll talk about ECG in cardiac chamber abnormality, okay? And it will be easy. You are required to know the basics from this lecture, not everything, but we'll give you everything, okay? So what do you know about left ventricular or cardiac chamber dilatation? What do you know? You know too much or not? Too few? Okay, good. Okay. Is it important? Is it important or not important? Very important or not important? Mildly? Mildly? Okay, so now. Okay. So we said from before, from the previous lecture, if you have abnormality in right or left atria, you're going to see this in which wave in the ECG? In the B wave. So simply, if you have right atrial or left atrial dilatation, you're going to see this in the B wave. And if you have abnormality in right or left ventricle, you're going to see this in T wave. Follow? T wave ممكن؟ لا ممكن. It's only in the QRS and T wave will follow. Okay. But for the medical student, you need to go for pathogenesis and pathophysiology, and this is very important. So what makes left atrium or right atrium or left ventricle, right ventricle dilate and pay attention to the tail dilatation. So that means there is another tail, صح?
Yes.
Okay. So can you explain?
Mitral stenosis?
Maybe regurgitation of the valves,
Okay.
it can cause dilatation of the
Increase in volume. This is very important. So if you have something to increase the volume in specific cardiac chamber, that means this chamber can get dilatation. Okay, and be careful to this the terminology. That means there is تخرم. So اختبار الساعة 10 أخلص. Easy exam. Okay. Easy. So that means there is something extra. So we have right ventricular dilatation. Is that easy? No time?
في ECG ما عرفناها
لا تقول كلام كامل. أنا قلت بيجي إيه So we'll talk about this later. So the patient, if the patient has dilatation, we know the causes now. But if he has hypertrophy, so you really need to pay attention to this terminology. So what? خلينا نسأل. So what is the difference between dilatation and hypertrophy?
Hypertrophy is except
Okay. So you need too much clear صراحة. But in simple words, okay. If the patient has left or right ventricular hypertrophy, that's mean for sure that's mean the wall itself is bigger than usual, but the cavity is smaller. Well, it can be normal. Okay. But if the patient has dilatation, that means the cavity itself got bigger, but the wall may be normal or may be small even, okay? So this is that's why there is two diseases. We have dilated cardiomyopathy and we have hypertrophic cardiomyopathy. Each of them, they have differential, they have workup different, okay? So which one is worse now? So Nurhan, which one is worse? from خبرتك في الطب ما شاء الله. ها؟ سري؟ ما تعرف السؤال؟ ايش اسمك بنتي؟ اسمك ايش؟ اللي دائما ايوه which is worse? Is it dilated cardiomyopathy or hypertrophic cardiomyopathy?
dilated.
Good. So if we said heart failure, if the patient admitted with heart failure, or Baba with a heart failure, that's mean dilated or hypertrophic?
Dilated.
So it's dilated. Why? Because all the causes of dilated cardiomyopathy, what we are talking about in the lecture, it is ischemic, peripheral heart disease, radiation, postpartum cardiomyopathy. This all means dilated cardiomyopathy. But hypertrophic cardiomyopathy is either hypertrophic cardiomyopathy which is genetic, هذه خدتوها, or aortic stenosis زي ما أمها قالت, or hypertension. So this one is the wall is thick, but the cavity هيكون small or even normal. Okay, so this is the difference between hypertrophic and enlargement. Clear? So in this patient, this is the cavity. What we are talking about cavity, this is the cavity, this is the papillary muscle, and this is the wall. If the wall gets bigger, we have definition for bigger wall or the measurement, you don't need to know that. But if the wall itself gets bigger, that means hypertrophy. If the cavity itself gets bigger, it will be dilated. So term dilated means wide ventricle in simple way. Clear? Is this applied to the atria also? No. The atria only got dilated because it has only thin wall, no muscles, so it got only dilated, no hypertrophy in the atria. Okay. So for you guys, you need to know the scenario, you need to know the clinical diagnosis. So what are the causes of left atrial dilatation? Left atrial, تسمع الصوت ولا ما سمع؟
Yes.
So what are the causes of left when the left atria got dilated? This is number one. So the clinical scenario, it will be a young lady, diastolic murmur. Is it diastolic or systolic? Diastolic murmur. Mitral stenosis, tricuspid stenosis, diastolic murmur, and they came to clinic why?
Atrial fibrillation, palpitation.
ممكن extreme. نقول حاجة مهمة. ممكن this is extreme cause, extreme of that mitral stenosis. But they came to the clinic because of progressive shortness of breath. This is the clinical sign of the mitral stenosis. Okay, and we're going to do ECG for this lady. Okay, why she has shortness of breath? Okay, so what you're going to see in chest in ECG. Yeah. Any volunteer? Yes, please.
5 different B waves.
So this patient, she has B wave here. This is B wave or T wave?
B wave.
Not T wave?
No.
Cannot be? Okay, even I told you this is a T wave, I can't be wrong? Yes. Can be. So why this is the B wave? This is the before QRS, and it is small, but there is something wrong with this B wave. It's like the shape is not good, okay? Okay, just forget about this now. The QRS, they are okay, they are narrow, and the rate 1, 2, 3, 4, whatever, and it's good, okay? So by abnormal shape of the B wave, it lead to abnormal shape or abnormal width or height of the B wave lead to cannot be something except right atrial dilatation. Okay, so if this patient lead to don't worry. So in atrial enlargement, you're going to see lead to. Why lead to? Because it is near to the right atrium. Okay, and V1Y because it is near to the left atrium, and you're going to see both of them. This is in the, if you go deep, is the ECG recording. The first portion it will be right atrium, and the second one it will be left atrium. Okay, and normal numbers of the B wave, it should not exceed 2.5 millimeter, 2.5 small square. Okay, and it should not exceed 0.1 second, which is like big square and a half. Okay, so exceed those number, you can say this patient has atrial enlargement. So we'll take more example, don't worry. So now, first one, our patient, she has stenosis. So this is the normal patient, okay, and this is abnormal patient. So lead one, you will have like two portion or bifid, we call it bifid before, but we don't use this terminology anymore. And in lead V1, you will have positive and negative wave. It's like two waves, okay? That means ECG is according to atrium, okay? That means left atrial dilatation. Remember the scenario, because you cannot answer atrial dilatation for a student level except if you read the scenario, okay? So we'll go to this will give a summary. So this normal patient, there is a small B wave, small B wave, and in V1 there is a small tiny B wave. But in this patient, which is our patient, she has mitral stenosis unfortunately, there is like two waves. There is one and there is two here. And there is deep deflection in V1. B-wave is not doing this. So for sure, and we're going to read the scenario, the patient has rheumatic heart disease, she has diastolic murmur, and she is coming with shortness of breath. And this cannot be except something what we call it left atrial dilatation. So who are going to give a summary? Yes, please.
So in case of rheumatic heart disease,
Okay, so which is here, mitral stenosis.
and in lead we will see two portion B wave,
Yes.
and in lead V1 we will see big deflection.
If you want to make it simple, you can call this is double shape or bifid, V wave or M shape. So we're going to repeat عشان رؤى, okay? Group leader. So we are talking about atrial dilatation, okay? So in the atria we said if we have abnormality in the atria, you're going to see this in B wave, okay? And we start with the first scenario, patient with mitral stenosis. She is coming to the clinic because of progressive shortness of breath. And those cases, all the time, they came to the clinic when they are pregnant. Why? Because the heart rate is going up and mitral stenosis will increase in severity. So we took this patient and we did for her ECG. And we are really interested in B wave. Why? Because she has mitral stenosis. In the scenario, they will tell you the patient has diastolic murmur, increase with exercise. This is typical for mitral stenosis. هتاخذوا هذه الأشياء إن شاء الله later on. So this is normal patient رؤى, and this is abnormal, which is our patient. So what we're going to see رؤى here, this is the B wave, this is the B wave, this is B wave, and this is B wave. What you are noticing about B wave? يعني in simple words, there is something wrong or there is something that's okay. So B wave here it's like
two.
Exactly, like two things here. And also in V1,
Like
there is one above and one below. Okay? So this is typical for left atrial dilatation. Remember, atrial dilatation, you can see it in all leads, but in for positional interest, it will be in lead 2 and in V1. So we are good now with the left atrial dilatation. You're going to read the scenario, okay? Then you're going to answer the question. And those numbers, you cannot apply it in the exam. If you're going to see big B wave, go for left atrial dilatation immediately. Don't measure it, okay? So what are the causes of left atrial dilatation? You have mitral stenosis, which is very, very common in our country, okay? Mitral regurgitation. Very common also. Why? Because as one of your colleagues said, mitral regurgitation gives you more volume in the left atria. And left ventricular hypertrophy, why? Because the atria contract against stiff myocardium. So the atria, when it comes in the history, will contract. So the blood will go to the left ventricle. But when the left ventricle gets hypertrophy, there will be increase in pressure. So the atria will contract against high pressure. So the atria got dilatation also. And this is applied in all cases of left ventricular hypertrophy. Okay? We'll come to that in the left ventricular hypertrophy. So now, come to the other scenario. Young, remember young boy, he's 14 and he's coming with high GFB. Her mother noticed the neck is engorged. Okay, she brought him to the hospital. He's not complaining anymore. And the cardiologist, he auscultated his chest and he heard diastolic murmur in the right side. Okay, increase with inspiration. And this is the ECG. So we are really interested now to see the atria. Okay, so in lead one, there is something here, we don't know what is this, and there is a wave here. And Nurhan said, this is the QRS, and this is something extra. She is wrong or right?
Wrong.
Why? Yeah, Nurhan. Okay, yalla, correct yourself. What is this and what is this?
The second one is the B wave.
This is B wave?
No.
This is B wave?
Yes.
This is big for B wave.
Yeah.
What? So how you can confirm the other groups? This is the B wave, not something, maybe the patient has another QRS. Why? So if you're going to make sure, just go up. So this is for sure, this is a B wave. And it is followed by QRS. And this is really, really big now, okay? So this is for lead 2. And we're going to see lead V1. V1, the B wave is acceptable. It has also negative portion here, but it's not big. So this is reflective. It is typical for right atrial enlargement. And remember, right-sided problem, which is tricuspid stenosis, tricuspid regurgitation, pulmonary stenosis, pulmonary regurgitation, it is all the time pediatric problem. It's not adult problem, okay? So it is a pediatric problem. لو يجيكم young يعرفوا إن المشكلة يا في الترايكاسبيد أو في البلمونري. هتاخدوها إن شاء الله مع الدكتور سهلي soon. Okay? So this patient has big B wave and nothing wrong in the V1. That means he has or she has right atrial enlargement with the scenario. You have to read the scenario. So this is a summary. This is normal ECG, and this is very big right atrium. Okay, because the patient has whatever problem in the valve, and will give you big B wave in lead 2. And also it can be big also in lead V1, but أكثر in the lead 2. Clear? So if I give you a scenario of right atrial enlargement, will be good enough? ما هتقولوا صعبة؟ I hope. Okay. So this is the definition of the B wave. It must be more than 2.5 millimeter, and that's it. This is another example. Big B wave, big B wave in lead 2, provided the scenario. Okay, لازم it has to be scenario oriented. Okay. What is the cause of right atrial enlargement?
Genetics. There is regurgitation.
So congenital heart disease, remember, it's the most common cause. Tricuspid stenosis, هتاخدوها إن شاء الله مع الدكتور السهلي. Pulmonary stenosis, very common in pediatric group. It's not disease of adult actually. But when you come to the adult, pulmonary diseases, it is the most common causes to cause right atrial enlargement, like COPD, pulmonary hypertension, pulmonary embolism, and mitral regurgitation, mitral stenosis, if they lead to pulmonary hypertension. So it's all going to the pulmonary artery. If the patient has severe mitral stenosis, severe mitral regurgitation not treated, this will make the atria so big, so the patient will develop what we call it core pulmonale, اللي هو pulmonary hypertension in particular, and the patient will have right atrial enlargement. And this is typical scenario in the pulmonary rotation. ناخدوها إن شاء الله. Okay. And this is also typical in our patient here. She is 30 years old lady, and remember, pulmonary hypertension is very common in female. It's not disease of male, okay? And she is coming with progressive shortness of breath. So those patients, before we're going to see chest X-ray, before we're going to read the ECG, we are sure they have ECG abnormality, okay? So what's ECG finding here? The B wave here is like M shape. Before قبل 40 سنة 50 سنة they call it M shape B wave. We are not using this terminology anymore, but it's really there. So there is M shape, and there is the B wave. The big portion of the B wave, the negative portion of the B wave here, is really huge. Okay, so this patient has both right and left atrial enlargement. Why? Because she has severe pulmonary hypertension, affect both. Whatever. Okay, so this patient, she has biatrial enlargement. This is very advanced for you, but this is the ECG finding. Okay, and this is summary. When you go home, you really need to read this, please. So if the scenario oriented about atrial enlargement, you're going to see lead 2 and V1. Theoretically, the first portion of the B wave, they call it, belongs to our right atrium. The second portion, it belongs to the left atrium. If you found isolated lead 1 big B wave, and this is the most common scenario, this is right atrial dilatation. In cases, you have to link it with the case. It is, for example, tricuspid stenosis. Okay. But if the negative in lead V1, this is isolated left atrium, and it can be both. You can have both atria dilated. Okay, clear? So when you're going home, please, you need to review this carefully. Okay? Yes, please. Not necessarily, but you go with the leads. If it is only in lead 2, that's mean most of the time right atria plus you need to read the scenario, because you cannot tell from ECG alone. M shape in lead 2. This is more in lead 2, like this one. Yes. First thing, you really need to read the scenario. Second thing, you need to see lead 2. There will be M shape plus V1. It will be negative, big negative deflection of the, like this one. This is the QRS, and before the QRS there is big B wave also. So this patient has both. Okay, right and left. And when you go home, please review this carefully, because this is important.
So doctor, how would we differentiate a right atrium just a left?
Of what?
Just a left atrium.
I cannot hear you.
How do we differentiate between the left one and both the atria? So by that, both of them are the same.
Both you will have both finding in lead 2 and V1. Both, provided the scenario. You have to read the scenario. Okay? We can answer this question if you have more question at the end. But now we'll come to the important thing, which is ventricle. And as we said, ventricular wall, if got hypertrophy, the wall itself got bigger. Okay, Nurhan? You will not confuse شكلك اليوم مرة. زعلانة من الاختبار. خلاص فرقتنا قدام. سؤالي من تاني. كلكم زعلانين؟ The male side, they are very happy. They are very happy. Well, listen to the music there.
See them after the grades, doctor.
Okay?
Ask them after the grades.
Okay. So left ventricular hypertrophy is very, very important. Actually, it is exam material. Left ventricular hypertrophy is all the time exam material. Why? Because it is important and it can give you, it's easy, we can create MCQs from the left ventricular hypertrophy. Okay? Why all the people, they need to know left ventricular hypertrophy? Is there a clinical reason?
It's like because it's the most
Okay. Because left ventricular hypertrophy can mislead you or can mask diagnosis of ST segment elevation MI. That's why it's very important. Left ventricular hypertrophy and left bundle branch block, it can obscure ST segment elevation MI. That's why you need to read the ECG carefully. When the patient has left ventricular hypertrophy or left bundle branch block, you really need to be careful when you're going to read the ECG, okay? Because it can mask the presentation of ST segment elevation MI. Because left ventricular hypertrophy can give you ST segment elevation, can give you ST segment depression. So you have to be very careful. That's why left ventricular hypertrophy is very important. And in the scenario, you can easily diagnose, differentiate between them. ST segment elevation ST segment elevation, my patient will have chest pain. But in an LVH and left bundle, most of the time there is no chest pain. That's why it's important. So if ask Ru'a. So if you have a patient with left ventricular hypertrophy, okay, so you are interested in which part of the ECG to see. Is it atria or the QRS or the T wave? QRS, okay. And the QRS Ru'a will be wide or tall?
why?
Choose one.
Tall because the amplitude should increase.
It must be tall only. Well, because wide mean
Time.
dilated ventricle. Wide mean very diseased ventricle. Remember this. So there are a lot of criteria to diagnose left ventricular hypertrophy. And the Faisal student, because you are so good, we give you all the criteria and then we'll ask you about. But the easiest really, we need to give you all. The easiest one is what we call it Sokolo criteria. And it's very easy. Just relax and follow with me. So if you have a patient with left ventricular hypertrophy, okay, how we can create a scenario? ممكن. Athletes عادة they don't have left ventricular hypertrophy. Hypertension. Remember, hypertension in the MCQs means something. ما نحطها عبث كده, okay? Other scenario? Exactly, aortic stenosis. Very, very important. If you put this in the exam, that means there is something hidden in the MCQ. Okay? So the scenario will be hypertensive, aortic disorder, aortic stenosis, and other disorder. Aortic regurgitation can give you hypertrophy or dilatation? Dilatation. It's a disease of dilatation. Because disease of volume, not pressure. Okay. So in this patient, he was referred from Dr. Sulaiman Kharabsha clinic, he's consultant cardiology, and he's young, he's healthy, he's whatever the age, 17, 16, and he wants to join a football club. يبغى يلعب في نادي, okay? And by protocol we will do ECG for those patients. We have to do ECG for them, okay? And he's the cardiology clinic, and you did ECG. Maha did the ECG, alhamdulillah, and she's intern. She's going to finish this patient. She has no time to discuss with the consultant. What you will tell him? You will tell him go and play, or you have to stop. You are allowed or not allowed? Or you will discuss with the consultant. That's the easy. So what you are noticing about this ECG?
It's tall.
The QRS, there's something wrong with the QRS. لدرجة بالعربي يقولوها داخلة في بعض الQRS. يعني here the R wave داخلة في S wave. This one is so big for the QRS. This one is so big for the QRS. So is he normal or abnormal to start with? But he has no symptoms. He's okay. So that means there is something wrong in the ECG. And if you remember in the first lecture, we said if the patient has positive or big R in V1, it cannot be except 7 differential diagnoses. And what are those?
Yeah, the dextrocardia.
Okay, good. This patient has dextrocardia, we don't know.
Or a problem
Next.
the ECG electrodes themselves أصلا.
I cannot hear you really.
It's dextrocardia.
Yes, pay attention to those things. This is very important.
It's either dextrocardia or يعني a mistake in the placement of
Yeah,
the
so they
ECG.
mislead,
Yeah.
wrong lead.
ممكن right bundle.
Or لا.
مهم جدا this one. This is the right bundle. It's very, very common. Okay. Only this?
لا.
Right ventricular hypertrophy. Right ventricular hypertrophy. WBW. Duchenne muscular dystrophy. Those are differential diagnoses of big or positive RNV1. If you remember, those I stress on those things in the first lecture. شكلكم نسيتوها. Whatever. Okay. So if you have positive R and V1, it cannot be except one of those differential diagnoses. Believe me. مهما لعبوا في السؤال واحدة منهم حتطلع. If the patient has chest pain, it must be posterior MI. If he has wide QRS, it must be right bundle branch flow. If she has progressive short split, cannot be except right ventricular hypertrophy. If he has muscle problem, it must be Duchenne muscular dystrophy. If he came with syncope, this must be WBW. لو ال ECG معكوس معناته انه ديكستروكارديا. ممكن نكتب 7 MCQs بالراحة منها. Okay? بعدين تقولوا صعبة. Okay. So remember, right ventricular hypertrophy, if you're stuck, there is also backup. Nurhan زعلانة today. So what is the backup for right ventricular hypertrophy, Nurhan? What is the backup? If you're stuck, you don't know. This patient has right ventricular hypertrophy or not, I don't know. You have mental block in the exam, so what are you going to do?
Check the axis.
Exactly. You need to check the axis because all the cases, not all, most of the cases of right ventricular hypertrophy, they have right axis deviation. Right axis deviation means something deviate electricity toward the right side. The big muscle deviate the electricity toward the right ventricle. So it will give you right axis deviation, which is really there in this patient. So this patient, she has or he has deep S in one and deep S, we call it negative. So this one and this one define right axis deviation. Okay. This is it. This is explanation of the right ventricular hypertrophy again and again. And this is lead V1. We will have positive R in V1. Thus define right ventricular hypertrophy. And right axis deviation, you're going to see right axis deviation by negative. Negative معناته ال S wave bigger than the R wave in lead 1 and AVL. That means something took the electricity from the lateral to the right, to the right ventricle. Okay. So this is the criteria as we discussed exactly. So this patient, young lady, she has progressive shortness of breath, pulmonary hypertension, and she has this ECG. You have any doubt this patient, she has right ventricular hypertrophy? She has big R wave in V1, it cannot be big like this. And also she has ST segment changes. This follow right ventricular hypertrophy. Okay, so we're going to do echo. So what are the causes of right ventricular hypertrophy? When the right ventricular muscle gets bigger. متى? At what cases?
Pulmonary hypertension.
Pulmonary diseases like COPD, emphysema, yes, pulmonary hypertension. Pay attention to this. And congenital heart disease like pulmonary stenosis. What do you think about tricuspid regurgitation? Can give you right atrial dilatation or right ventricular hypertrophy?
Dilatation.
Dilatation. Remember, all the volume diseases give you dilatation. It will not give you hypertrophy. Okay, and remember the differential diagnosis of positive R. This is favorite in the exam في كل الجامعات. Okay. So now we can discuss something else with this patient also from cardiology clinic, and he has whatever he has here. Sometimes in the ECG we're going to write the clinical scenario. So this patient, as your colleague said, he has hypertension, okay, and we are doing ECG. His ECG is normal or there is abnormality?
There is
Abnormal. Why? Because the S wave here is so deep, and R wave is so big, so big R wave. So if you calculate this wave, 1, 2, 3, it will be 15 small square, and here 1, 2, 3, 4, it will be more than 35, which is the Sokolo criteria. You are not required to do this in the exam. Just if you saw big R wave, provided the scenario, the patient has hypertension, has systolic ejection, systolic murmur, that means for sure he has left ventricular hypertrophy. Okay, and this is Sokolo criteria. We are not going to discuss it because it is easy. Okay, and criteria, there's a lot of criteria actually, a huge number of criteria, but the easiest one is Sokolo criteria, which is S wave in V1 plus R wave in V5 or V6 more than 35 millimeter. Okay, يعني معناته it will be left ventricular hypertrophy, and you are good enough. If you go with the visual assessment, it will be good enough.
Doctor, can you repeat this point? The Sokolo.
Yes. You remember كل هذه criteria. Okay, there is a lot of criteria to diagnose left ventricular hypertrophy. Okay, this is not part of your student يعني exam. لكن visually going to see the R wave is big in V1 or V2, V3, whatever. Like this patient, he has big R wave, big R wave here, big R wave, big R wave. Okay, so this patient for sure he has left ventricular hypertrophy. We need to confirm this. We're going to use one of the criteria. Sokolo criteria is the easiest criteria, and you can calculate the small squares here. One, for example, this is 5, this is 5 also, and this is 5, and this here, for example, 3 or something. And R wave in V5 and V6. Each big square has 5 small squares inside. So each one is 1 millimeter. So you can calculate if there is more than 35 millimeter, that means he has positive Sokolo criteria which define left ventricular hypertrophy. But remember, you have to guide it with the scenario. It's not enough. Okay? So you only go for Sokolo criteria. Other criteria you can read it at home, no problem. For your interest, no problem. And this is Sokolo criteria, it's very easy. S wave in V1, remember S wave, not R wave in V1. Can I repeat it? S wave in V1, R wave in V5, V6, it will be more than 35 millimeter. If you saw this in the exam, you can easily say this patient has left ventricular hypertrophy. And other criteria, just ignore it. Now we're going to apply those criteria. So this patient, whatever, there is no history here, and he is in cardiology clinic, and you did this ECG. You have any doubt this patient has a huge muscle in his heart? Without any criteria. Okay? In the atria, he has any problem in the atria? Maybe, because his negative part of the V1 is bigger. Remember, left atrial enlargement follow left ventricular hypertrophy. If you have left ventricular hypertrophy, for sure you will have left atrial dilatation at different extent. Okay. And also you can see ST segment depression. Also it comes with the left ventricular hypertrophy. As we said, it can mislead you to diagnose the patient with non-ST segment elevation MI. Causes hypertension. the most common and the easy one to put it in the scenario. Aortic stenosis, hypertrophic cardiomyopathy, and I assume you took this subject. It's very, very important. And when you have left ventricular hypertrophy, as a mortality issue, patient with hypertension and has left ventricular hypertrophy, they do worse all the time. They can go for congestive heart failure and arrhythmia. So now we're going to practice. Anyone volunteer? Rowan? Yeah, no. So let me make a scenario for you, please. This patient, he has hypertension, uncontrolled hypertension. When he came to the clinic, his blood pressure 200 over 100. He's not taking his medication. He's a smoker. He's using alcohol. Which other scenario? Bas.
Left ventricular hypertrophy.
Okay, so this patient for sure he has left ventricular hypertrophy. But you're going to examine deep. He has any atrial abnormality also? ممكن يكون عنده left atrial enlargement. Okay. This example from Dr. Bandaravandi clinic. Okay. Who's going to answer this? You want?
Yes.
Yeah, no.
Is it also left ventricular hypertrophy?
Left ventricular hypertrophy. What do you think the atria?
Yes.
Yes. ممكن يكون عنده ممكن. Okay. ممكن.
Why ممكن؟
No?
Because
Remember, you need to guide with the scenario. السيناريو هو اللي يحدد لك. طبعا احنا in the exam will not give you two complicated choices. So will not give you left ventricular hypertrophy plus left atrial dilatation, يعني too deep for you, too much. So this patient, you need to answer this correctly because this is exam ECG actually صراحة.
Left atrial largest.
left atrial.
Number one, he has left atrial enlargement. ممكن يكون عنده right برضه؟
No.
ما في M shape here يعني McDonald shape. And here, this is the B wave, which is very broad and deep. Okay, and this is the QRS. Sometimes with the atrial enlargement, you will be confused. Which one is the B wave? Which one is the QRS? But alhamdulillah, you are okay. So what do you think about the ventricle itself? Okay, very large. Yes, good. So this patient has complex disease. He has atrial enlargement, he has left ventricular hypertrophy. So this is combined disorder. This is you need to answer this also correctly. مين اللي هناك اللي معه مشاركة؟ هناك شيء. You want? أنت ولا اللي جنبك تاني تتكلم؟ السلام عليكم. Can you answer this please? Okay. So a scenario, this patient, she is from, I don't know who's Samman clinic, looks pulmonary clinic. She is coming with progressive shortness of breath. She cannot do any exercise or any activity without shortness of breath, and ECG is done. And the answer is here.
Right atrial positive always because of the pulmonary disease.
What is the question?
Right atrial enlargement.
ممتاز. ممكن يكون right atrial enlargement. The B wave is here is big, don't ignore the B1.
Yes.
What's wrong with the B1?
Right ventricle hyperatrophy.
Right ventricle. Right ventricle.
What's wrong with the V1 here?
قريتها من السلايد دكتور right ventricular hypertrophy.
What is right ventricular hypertrophy? This is very important ECG. Okay. Sorry? Right ventricular hypertrophy. Why? Because this patient has big R wave in V1. It should not be as big as this. And B wave here also is big. If you go with the definition, it will not exceed 2.5 millimeter. Here 2 small square and a half. So this for sure exceed that. Yes, please.
It doesn't look like an M shape though.
Yes, M shape. We said this is if you M shape. This is a left atrial dilatation. But this patient, scenario oriented and ECG, the B wave here is big. more than 2.5 millimeter. And V1 is positive. We said 7 differential diagnosis of positive V1. And this case is right ventricular hypertrophy plus right atrial enlargement. So in this case, this is also good. So she will answer. Can you answer this? Hey, you. Yes. So this patient, he has multiple valve disease. He has mitral stenosis and tricuspid stenosis. And this ECG is done. So we're going to see this V wave is here and V wave is here. Right atrial enlargement, okay, ممتاز. So what's wrong with the left atrium also? Yeah, because he has big B wave in lead 2 and deep what we call a deflection of the B wave in V1. So this is left axis deviate, left atrial abnormality, and also he has LVH, and if you said right atrial, you will be fine also. Can we repeat? This patient has big wave in lead 2 and negative part of the B wave in lead V1 is big also, and the QRS, they are huge. So this patient has left ventricular hypertrophy and left atrial enlargement. If you said right also, I can accept that because he has also here something, okay? This patient also. Yalla. So what do you think about B wave here? It's normal. Too much of B wave. We said B wave must be small, tiny. So this is more than. If you start just calculate it. It must not exceeding 2.5 millimeter. They are 2 small squares and a half.
So it's big, يعني right?
Okay. This can be big and can be right. But look to the V1.
So by left.
B wave is inverted, has like negative deflection here. Usually B wave is not doing this. Okay. Okay, if you said bilateral, so you will not be wrong, but and also he has left ventricular hypertrophy, so bilateral enlargement and left ventricular hypertrophy. You need to go through this exercise again and again. The summary for this slide will be here in those practice. So you need to practice 1, 2, 3, 4, 5, 6 ECG.